So continuing the series of ophthalmology, today we are going to discuss about blepharitis. Okay, blepharitis. So what is blepharitis? Blepharitis is the inflammation of eyelids, uh, particularly the oil glands in the eyelids. So how will you define blepharitis? Blepharitis is defined as the inflammation of oil glands in the eyelid margins. Okay, so this is the definition. Now, talking about the causes, what causes blepharitis? There are a number of causes, and going through the causes quickly. The cause may be bacterial, may be allergic, may be viral. So let me talk about the causes. Okay, so bacteria like staph bacteria, Staphylococcus aureus are very much important in causing blepharitis. Okay, allergens like dust particles, like smoke particles, like certain chemicals, like certain drugs. Okay, allergic reaction to some drugs, ophthalmic solutions. Okay, ophthalmic solutions, contact lenses, all the things that can cause allergy may be causing blepharitis. Okay, and amongst the viruses, there are viruses like herpes simplex virus and varicella zoster virus that may be causing blepharitis. Okay, so these are the causes. Now, whatever is the cause is not the thing to be focusing on. We do not need to concentrate much about this. We just have to know about the causes, and we really have to concentrate on the types of blepharitis. Okay, the clinical sign symptoms which are being presented, that are the things that need to be concentrated. So talking about the types, there are basically two main types of blepharitis based on the location. Okay, so I'll talk about this thing. I'll talk about the location thing now. Okay, so the one is anterior blepharitis, and the other one is posterior blepharitis, which is also known as Meibomianitis. Okay, Meibomianitis is the name which it got from the Meibomian gland present posteriorly in the eyelids. So let me draw the diagram, and it may be very much helpful in understanding the location of the blepharitis. Okay, the types of blepharitis. So this is your eyeball. Okay, and let me draw the eyelids now. This is the one eyelid which is present superiorly, and this is the other eyelid which is inferiorly present. Okay, now in these eyelids you see that there are eyelashes. I hope you understand. It's very clear. It's not much complicated. There are these eyelashes. Okay, these are the eyelashes, and now I'll zoom this portion. Okay, मैं इसको zoom करके दिखाऊंगा आपको इस portion को. ठीक है, so I'll zoom into this portion, and I'll show you the anterior and posterior parts of this eyelids. Okay, so suppose this is the eyelid. Okay, and this is that eyelash. So you know that whenever there is eyelash is similar to hair, and there will be hair follicles present, and you know that whenever there are hair follicles, there are glands present in close to the hair follicle, and those glands produces sebum. Okay, so these are the glands. Okay, one gland this, and the other gland maybe this one. Okay, so these are the glands which produces oil, and these are actually the glands which are responsible for keeping this hair follicle alive and moist and strong. So these glands are very much important. I'll write the names here. Okay, the names of these glands are these. Okay, so the one is the Zeiss gland, oil gland, and the other oil gland may be this one, which is known as mole gland. Okay, mole gland. So these are the two very much important glands which are, you know that I have divided this portion. Okay, so this is the portion. This is this part is known as anterior part of the eyelid. Okay, and inside the anterior part of this eyelid are present Zeiss gland and mole gland, these two glands which are producing oil for the growth and nourishment of this hair follicle. And this is the part which is known as posterior part. Now you understand what was I talking about when I told you about the classification based on the location. So this is actually the location which was I talking about. In the anterior side, you can see two glands, the Zeiss gland and the mole gland. And on the posterior side, you will see another gland that will be that will be the Meibomian gland. This will be the Meibomian gland. Okay, this will be known as Meibomian gland. So these are very, very important glands to know. Meibomian gland. Okay. This was all which I was trying to make you understand. You have to know these all structures before you know about the types of blepharitis. Blepharitis has two types. The one is anterior blepharitis. The anterior blepharitis is the blepharitis which is due to the inflammation of either Zeiss gland or either Mole gland. And the other one is posterior blepharitis. Posterior blepharitis is either due to the it is solely due to the inflammation of Meibomian gland. And all of these glands, the Meibomian gland, the Zeiss gland, and the mole glands, they are all present in the eyelids for the production of sebum and oil, and they are very much important. So this is the classification of blepharitis into two types. The one is anterior blepharitis and the one is posterior blepharitis. Okay, so I'll talk about this more in detail now. Now you know that anterior blepharitis or the Meibomian and the Zeiss gland may be infected with bacteria, and the bacteria which is very much common or famous is this one, the streptococcal bacteria. Okay, and it may be due to the blockage of the sebum. The ducts which are supplying this hair follicle may be blocked or clogged and may be producing seborrheic blepharitis. Okay, so this is the two things which needs to be discussed. These are the causes and types of anterior blepharitis. Okay, and posterior blepharitis, which is solely caused by the inflammation of Meibomian gland, will also can also be called as Meibomianitis. Okay, Meibomianitis from the gland Meibomian. So okay, so now coming towards the clinical features of blepharitis. First, we will discuss about the clinical feature of anterior blepharitis. Okay, so the anterior blepharitis has two causes, as we discussed earlier. The one cause is staphylococcus, and the other cause is seborrheic or blepharitis. Okay, so there will be difference in between the two types of anterior blepharitis, but generally the sign symptoms are very much identical and very much less things to be differentiated between. Okay, so the clinical features of anterior blepharitis. In anterior blepharitis, the eyelids will have red appearance. Okay, there will be erythema of eyelids. The eyelids will be red in color. There will be inflammatory signs present in the eyelids, and as you know that the eyelashes hair follicle will have inflammation, so maybe the eyelashes they may fall because the roots of these hair follicle get so much tender that they are easily to detach. Okay, so lashes loss can be a sign symptom. Okay, you know that the hair follicle is being infected and it's causing disturbance in the normal structure of the eyelid. So it may cause bending of the eyelashes. So you may see a person not with the beautiful eyelashes. Maybe the one lash is going towards east and the one is going towards the west. So eyelash bending can be a sign. Okay, okay. So the one thing that is just distinguishing between the seborrheic and staphylococcal anterior blepharitis is the crust formation or the scale formation. Okay, so whenever there is a staphylococcus or staphylococcal blepharitis, infectious staphylococcal blepharitis, the crust formation will be yellow solid crust. Okay, the crust will be solid crusts, and it may form scales, and those scales will be like solid hard structures. So if the scales are hard, it may be staphylococcal blepharitis. And if the scaling or the crust formation is oily, it's greasy, and there are like there is oiliness present in the crust, it may be due to seborrheic blepharitis. Okay, it may not be due to the staphylococcal, it may be due to the seborrheic blepharitis. So it is easy to distinguish between staphylococcal and seborrheic blepharitis. Okay, just by looking to the crust. If the crust is solid and dry, it may be staphylococcal, and if the scaling is oily, greasy, it may be seborrheic. So this is very much distinguishing point. Okay. Then coming to the clinical features of posterior blepharitis. Posterior blepharitis is uh, is mostly same to same, is same as the anterior blepharitis, and there is not much thing to differentiate. Just the thing which is going to be different in the posterior blepharitis is the burning sensation during the flashing of eyelids. Okay, you know that there is this thing which is known as anterior eyelid. Okay, and there is this conjunctiva which is covering the cornea and anterior part of the eyelid. So whenever there is the inflammation here in the meibomian gland, the inflammation will cause pussy discharge, and maybe the duct which is bringing that meibomian discharge into the eyes, maybe that duct be blocked, and it does not allow the oil to be part of to come into this portion. So it may be like dry condition here. So whenever there is this blockage of this blepharitis, it may cause the decrease in the lubrication of this anterior part. And whenever there is decrease in the lubrication, whenever you blink the eye, you will feel the pain because of the dryness. So there will be like burning sensation whenever you blink the eye. This is due to the okay, let me write it out. Okay, due to clogging of meibomian gland. Okay, so clogging of meibomian gland means less oily secretion. Okay, and more friction. And other symptoms are like lashes loss and lashes bending and erythema and crust formation, and everything will be same to same as the anterior blepharitis. So nothing much in the clinical features apart from this. Okay, now coming to the treatment, how will you treat blepharitis? Treatment is very much focused on conservative treatment. You have to do the lid hygiene, you have to wash the washing. Okay, you have to do the wash of your eyelashes daily. You have to keep the eyelashes very much dry, and keep it away from being infected. And if there is a posterior blepharitis and there may be clogging of the duct present, so you can do the warm compression. Warm compression can easily melt the sebum or the oil present in the duct, and it can help you treat the inflammation, okay, which is maybe caused by the clogged duct. And for supportive treatment, artificial tears can be given. Artificial are must consider when there are dry eyes. Okay, just like I told you in the posterior blepharitis, when there is less lubrication. So artificial tears should be considered. This is all about conservative treatment. But when it comes to the antibiotics, it's also very easy. If there is acute condition, not much inflammation, not much crust and discharge, and not very much grief situation, you can take the help of antibiotic ointment. You can take drugs like erythromycin. You can take drugs like sulfacetamide, and if the condition is chronic, if it is chronic, so you can use antibiotics, these antibiotics along with corticosteroids. Now, what is the thing with the corticosteroids? Corticosteroids is helping you to decrease or stop the inflammation in the chronic condition. So chronic condition, you must use corticosteroids. Okay, and if the case is a refractory case, refractory case means the cases which are being repeated after some time, like the patient is again and again coming with the same complaint with same blepharitis, and you see multiple cases in the same patient, so you must use broad spectrum or heavy antibiotics like tetracycline and doxycycline. So this is all about the treatment. Drugs includes this, and supportive treatment includes this, conservative treatment includes this. Okay, and this is all the thing. You can see in this picture that there are these crust formation in the eyelids. So the crust formation is showing you that it is a little bit greasy. Okay, greasy thing. Yeah, but I can see that the eyelids are oily here. So what could be the reason here? It may be due to seborrheic blepharitis. Okay, and you can search on the Google about staphylococcal staphylococcal blepharitis. Okay, so let me show you an example. It's time consuming, but it's like it's important. So anyway, let me put a picture here. Okay, let me show you crust formation. I hope I can see some pictures here. Internet is a bad thing to okay, here. I hope it's the thing which we are looking for. Yeah, you can easily look into the picture and judge about the cause of the this blepharitis. The lids are inflamed, and the lids have these yellow crust formation. Here the crust are very much dry. So when was the crust dry? Only in the case of staphylococcal blepharitis, and here the crust were not dry, they were greasy and they were oily. So this was seborrheic blepharitis. Okay, so this was the difference between seborrheic and staphylococcal blepharitis. Okay, thank you very much for listening. All of this slide is available, and I hope you understood what I was talking about. So specifically, you have to focus on the structure of the eyelid. Okay, if you know the structure of eyelid, I hope you are doing good here. Okay, so thank you very much for listening.